Anyhow, I'm Marty Ross, and this is another one of our conversations with Marty Ross MD tonight. As you all know, this is a webinar where we're going to discuss Lyme disease. And basically, these webinars are all created by you. They're created by the questions that you ask. And so I'm interested, as usual, to see what you have in store for me tonight. So the way to get your questions heard is to write your question to me using the chat box. And I will then take the questions from there. And those are a starting point. So once I answer one of those questions, I will open it up for further comments that people may have or questions they may have around that question we just discussed. Okay. So when I say, does anyone have questions, it's not to start a whole new stream of thought. The only way we're gonna start a whole new stream of thought is if you wrote that question in the chat box, all right? But those follow-up questions are really just about the question that I ask at that point, all right? So I hope that's clear. If not, I'll remind you as we get into the webinar. And then I am creating a recording tonight's webinar as usual. And so my intention is that we get that out somewhere around 9:30, although it's been creeping a little bit more to 10 o'clock. The reason it seems to be taking longer is I'm putting timestamps in the video, and it actually takes a bit longer for me to edit and put timestamps in the morning. So anyhow, somewhere between 9:30 and 10, you'll get an email from me saying that that video is ready. If you want to use the timestamps, you actually have to use a link that I have that takes you to YouTube to watch it. If you're trying to watch it from my Marty Ross MD supplements webinar page, that doesn't, the timestamps don't operate there. Okay, so just to make sure everyone's aware of that too. All right. So I think without any further ado, let's go ahead and get started here. So the first question is from Colleen. Hi, Colleen. Let's see. I've been taking Ferrosaur one pill 2 times per day for about 9 months because my ferritin levels were too low, less than 16. And my most recent blood work, ferritin levels have gone up a bit, but are still not where they should be. However, my concern now with B12 levels, which were never out of the ordinary. I do not take any B12 aside. Uh, I do not take any B12 aside from what's in the Ferrosaur. Okay. Since taking the Ferrosaur, my B12 has gone to 905. Is this okay? As always, thank you for all of your wisdom. So that B12 at 905 is fine. You're not going to hurt yourself by getting too much B12. The Ferrosorb, the product called Ferrosorb, which is a Thorn product, the type of iron salt that is in that Ferrosorb is very well absorbed. That's why I recommend using that one. But in terms of a 905, I'm fine with that. I don't see a problem with that at all. All right. Colleen, did that answer your question for you?
Yes, it did. Is there a level I should be concerned with, like if it goes up to a certain number with a B12?
No, you're not going to become B12 toxic.
Okay. All right. Thank you.
You're welcome. Good luck to you.
Thanks.
All right. Hello, Larry Lee. Let's see. I'm dealing with major inflammation, especially when I take Japanese knotweed and cryptolepis. So Dr. Bruce Patterson with Health Bio put me on Maraviroc and Atorvastatin to lower my cytokine inflammation as I take my therapy. What are your thoughts on that and any other way to lower inflammation so I don't herx? So, Dr. Patterson is a doctor that kind of came to fame during COVID. And Dr. Patterson claims and no one's replicated his work. I just want to be clear about this, that there is a inflammatory fingerprint, a certain type of cytokine pattern that you can have if you have COVID, long COVID, or there's also a certain kind of cytokine pattern you can have if you have chronic tick-borne illnesses. And in either situation, to get the inflammation under control, he likes using an antiviral medication, which is the Maraviroc, along with atorvastatin, which is actually a cholesterol-lowering medication. I will be honest with you. I have not seen good results with Dr. Patterson's protocol. I haven't seen good results with it when people used it for long COVID, nor have I seen good results with it in treating chronic Lyme. I don't think he fully understands chronic Lyme, to be quite honest with you. He even presented at the annual ILADS meeting last year. Most of us in the room were like, I don't think he gets this. So anyway, I just want you to know I'm skeptical of his using a cytokine pattern to both determine whether it's long COVID you have or chronic Lyme you have given your symptoms. And I'm very skeptical for most people that the Maraviroc and Atorvastatin make any difference at all too. All right. So having said that, the issue I agree with him is that you have when you're trying to kill your germs, well, actually, for two reasons, you have increased cytokines. You have increased cytokines, first of all, because your immune system is trying to get rid of Lyme. And so cytokines are good and bad. They're made by white blood cells. They're made by white blood cells when a white blood cell sees an infection. And the good side is they're supposed to cause more white blood cells to be made. They help bring those white blood cells to where the infection is, and they help the white blood cells work better. Okay. So cytokines in the right amount are good. But in chronic situations like in Lyme and long COVID, often what happens is the immune system gets stuck on. It gets stuck in a position of just making too many inflammatory cytokines. And too many inflammatory cytokines can suppress your immune system, can make you hurt all over, give you brain fog, make it so you can't sleep, give you fatigue, make you hurt all over. So as you can tell by those symptoms I just described, those are tick-borne infection symptoms, but they're also the symptoms that would get worse when you have a Herxheimer reaction. All right. So what a Herxheimer reaction is, a killing reaction is, when your immune system sees dead bug parts, it reacts by making more cytokines. Okay. So when you feel like crap in tick-borne illnesses, there may be two things going on. One is your immune system is just generally overproducing cytokines. And if you happen to have started a new herbal or prescription antibiotic or increased the dose of that prescription or herbal antibiotic, you may have triggered more killing, which results in more cytokines, and we call that a Herxheimer reaction. So, the approach I like to use to get cytokines under control is more of an herbal approach, not a Dr. Patterson approach. And what I like doing is having people take taking curcumin or liposomal curcumin. And for example, a product of liposomal curcumin is Thorne makes a product called curcumin phytosome. Okay. It's a 500 milligram pill, one pill 3 times a day. And curcumin gets inside of your white blood cells and it limits their ability to produce cytokines. The other thing I like to do is to couple that with liposomal glutathione. And the reason, so liposomal glutathione, so glutathione is a very powerful antioxidant that is also used to detox things in our body. The reason to use it as part of a Herx reaction and to lower cytokines is that as an antioxidant, it blocks the signals that go to white blood cells that tell them to make cytokines. Okay. So effectively, if you're doing curcumin and you're doing glutathione, curcumin is blocking the factory on the inside, and glutathione stands outside and basically keeps oxidizing agents from telling the factory to start producing cytokines. Okay. Now, I like using liposomal glutathione because glutathione on its own is horribly absorbed. And the product I like using is a product made by Research Nutritionals called Trifortify. And they've got very good data proving that their product is well absorbed. Okay. So, a program that I would suggest a situation like you're in is to be on a liposomal curcumin, 500 milligrams 3 times a day, and being on liposomal glutathione at least 400 to 500 milligrams, which is 1 teaspoonful, 1 time a day. You could even go up to 2 times a day. Okay. All right. So do you have any, Larry, do you have any questions about that?
No, thank you very much.
We do. Sorry, Dr. Marty Ross. I'm here with my father to help him out. This is Diane Lee Hall.
Hi, Diane.
Yes,
Yeah,
good. We both contracted Lyme probably in Vermont, we realized. But anyway, a positive IgG test for both of us. He does and has been for a while taking the liposomal glutathione and the curcumin, but is still so inflamed and can hardly tolerate treatment. Any additional advice?
What's the dose? So for how long have you been on, or your dad been on the Japanese knotweed and the cryptolepis?
So he originally was on it in January and February and March and had to go off because he was just not tolerating it well. And then his symptoms didn't really improve a ton, but just a little bit. We got him, with obviously just trying something out, obviously Dr. Patterson, and then he just started the Maraviroc and that stuff, which now we'll reconsider, but he is has been on that only for about a week and already is experiencing just another tremendous kind of herx reaction. I mean, it's not to the point of headaches. It just is like a lot of brain fog.
So I want to be clear, is when you say he's experiencing these reactions, you think it's after he added in the Maraviroc then?
No, it's really noticeable after he takes the Japanese knotweed in particular. We both have Babesia and Lyme, but the Lyme symptoms are stronger for him. They're mainly neurological.
Okay, so I want to make a distinction then. I want to try to understand whether the symptoms that he may be having are side effect of the herbs or Herxheimer reaction from the herbs. Okay, so tell me about what's the dose of cryptolepis that he's on?
So originally we were going to do, because of the Babesia, the 1 tablespoon 3 times a day, but we brought it down to 1/2 tablespoon 3 times a day. And Dad, after you take the tincture, the liquid, you don't feel as much of a difference as when it's the Japanese knotweed he thinks it is the most.
Okay,
Yeah.
so I want to clarify. I think you mean 1/2 teaspoon, not tablespoon.
Yes.
Is that correct?
Yes,
Okay.
sorry. Yes, definitely
No, I don't
teaspoon.
want anyone going out there doing a tablespoon of
Good call.
cryptolepis, all right? All right. So you don't seem to have any kind of symptom worsening with crypto, but when Japanese knotweed is in the mix, there is a symptom worsening. Specifically, what gets worse with the Japanese knotweed?
Brain fog.
Just brain fog.
Yes, that's his main. I would say that's his like #1 predominant Lyme symptom. He does have some arthritis, but it's really the brain fog, and he has a balance issue. We think it's
Yeah.
affected his vestibular issue, part of his brain.
Okay. So does with the knotweed, other than the fog getting worse, do you see any worsening of energy or increased body pain or anything like that?
Not body pain, but energy. Yeah, he really pretty much can't do much.
After the knotweed.
Yeah, I mean, it's not as if it's not there before he takes the knotweed, but the knotweed, he's thinking potentially, yeah. I mean, it's
Okay.
still kind of bad before, but when he takes it,
Okay.
he just sort of feels useless.
All right. And then have you all tried, has your dad tried cinnamon, clove, oregano by a chance at all or not?
So he is also on that. That's new. We just started that for him this past week, so don't have a lot to judge on that one. But
Okay.
yes.
All right. So two things with the Japanese knotweed, and I cannot entirely tell here. I'll just start by saying that. Okay. One is I'm wondering about a side effect rather than true herxing. Okay. I'm wondering. Or it is possible that this is some kind of a irregular type herx reaction. And I think you've got a couple things you could try here. One is cut the dose in half. See if you can find a dose that doesn't seem to elicit the either herx or the side effect, okay? And I will let you know there are some people that are sensitive to certain herbs, either from a killing standpoint or just sensitive. And so sometimes it's just a matter of finding the dose that can be tolerated, okay? And like super sensitive people that herx no matter what they take. I have managed people with like cat's claw and otoba bark on just 1 drop twice a day and gotten them well. Okay, so I just want to let you know it's okay to go lower if you need to sometimes. All right. Now the other thing I would say is maybe the other alternative is just stop the Japanese knotweed altogether. Between the cryptolepis and the liposomal cinnamon clove oregano, you've got a Babesia treatment, crypto being the main agent, and the clove and liposomal cinnamon clove oregano can be helpful for Babesia too. And then in terms of Borrelia, cryptolepis is a very strong agent for Borrelia, both growing and persisting. And then the cinnamon clove oregano is good against growing and persisting. And then from a Bartonella standpoint, both crypto and the cinnamon clove oregano work well too. So even though I usually say if you really want to do a full cart press, throw the Japanese knotweed in, because I think there is a Japanese knotweed issue here, whether it's a herx or it is a side effect, you can just pull it out and see if he would progress with it gone then too.
Okay, good idea. Thank you. We'll try that. And real quick, just with the cryptolepis, is there any danger in taking that like long term?
No, I have, I've had in my practice, before I stopped practicing a couple of years ago now, I had people on that for a year or more at a time, and I didn't see any problems with that at all.
Okay. Thank you so much. Really appreciate it.
You're welcome. Good luck to your dad.
Thank you, doctor. Appreciate it very much.
You're welcome, Larry. Yep. Does anyone have any follow-up questions to that? Those things we were talking about there? Okay, let's move on. Byron, hello. It's been a while. I recognize your name. I can't see you here, but at least I don't think your camera's on here. But anyhow, hello. Let's see. Hi, Dr. Ross. Been balling Bartonella for 7 years. Tried doxy, rifampin, then your herbal protocol, which worked for 4 years, then stopped working. Been on methylene blue with fluconazole and azithromycin for 8 months, and soon as I stopped treatment, the symptoms came back after one day. Main symptoms are chronic fatigue, brain fog, muscle twitching, and tingling feet. What can be done at this point? Can fluconazole with herbs be a protocol as the methylene blue seems to be ineffective after being on it for a year? Also went on amphotericin B for 2 months, which did help a bit, but not fully resolve symptoms. Okay. So everyone, amphotericin B would be to kill intestinal yeast. Sometimes if you get intestinal yeast overgrowth, that triggers cytokine excess, which can make it look like your tick-borne infections aren't doing well. Okay. And I think that's what Byron was trying to tell me there. Byron, so let me ask you a few questions here. So when you're on methylene blue and haven't stopped it, and you're on fluconazole and the azithromycin, what's your health like?
Everything was good in the beginning. So when I was first taking methylene blue, the energy levels were through the roof.
Yeah.
And then with a period of about 6 to 8 months, it kind of peaked out, and then the fatigue started coming back more severe. So the fatigue gradually got worse and worse. And then it got to a point where actually when I stopped taking the methylene blue, the fatigue improved quite a bit.
Oh, it did. Okay.
So it seems like it was suppressing Bartonella, but it wasn't eradicating it.
Right. And then what's the dose that you were, and how long were you on fluconazole then?
Yeah, so I'm seeing Dr. Iller. She put me on the dosage for fluconazole was 200 milligrams once a day, and then I was on between 30 and 50 milligrams, like between those two dosages of methylene blue twice a day.
Okay. And then have you been doing any work on biofilms specifically, like lumber kinase or biodisrupt or anything like that?
Yeah, so I was doing 2 tablets in the morning of lumber kinase, and then
Okay.
I was doing a biodisrupt in the evening on
Okay.
an empty stomach. Yeah.
All right. And then have you may be aware, and people here may be aware too, one of the things I've been advocating is trying to repair injury to the inside lining of your blood vessels. The inside lining is something called the endothelial glycocalyx. And if it gets injured from infection, it results in less nitric oxide being produced. And so you don't get dilation of your blood vessels. Also, nitric oxide is a good anti-inflammatory too. We don't have any science proving that the glycocalyx gets injured, but there's a good likelihood it probably does. No one's done the research to look at it, okay? So have you been doing any arterisol by any chance?
I have not, no.
Okay. And then have you ever tried any itraconazole?
I have not tried itraconazole. Like Dr. Illa wants me on minocycline, rifampin, and fluconazole right now, but I'm kind of like hesitant to go back on antibiotics again after being on them for so long, twice
Sure.
already. Yeah.
Okay. And then I know you did amphotericin B, but let me just ask my quick yeast screening questions here. So any sugar cravings at all?
It's on and off, but I would say less than before.
Okay. Any intestinal gasiness or bloating?
No, it's a lot better than it was.
Okay. So sometimes when we get intestinal yeast, it can result in changes in your skin, like pimples and acne or skin rashes. Have you had any issues like that?
No.
Okay. And again, the amphotericin B was for 2 months. And then I'm having a hard time holding this one in my brain. So let me just ask it again. How long were you on the combination of methylene blue and fluconazole together?
I was on that for about 6 to 7 months, but the methylene blue I've been on for a year, like continuously.
Okay, okay. And then when you, I think, did you do the combination of cryptolepis with Japanese knotweed and cinnamon clove oregano before?
Yeah, and I'm back on that now. I'm taking just the herbs right now. The cinnamon clove, the cedar acuta, the houttania, and cryptolepis. I'm taking those 4 3 times a day or twice a day.
Okay. So, I know you're working with Dr. Iller too. So one of the a couple of things to think about. So clearly you've stopped having progress here, and I'm not hearing that there's active yeast that's tricking us into thinking it's the tick-borne infections are a problem. Okay, so I'm not hearing that. Plus, you did try to deal with yeast by using amphotericin B without much improvement. So you kind of did the test on that. Okay. So then I agree.
Better.
You did get better, but you're not all the way back to where you want to be, basically.
Correct. Yeah.
Yeah. So I would have to also wonder, has there been some resistance that developed either to the fluconazole or the methylene blue or the combination of both? Okay. And at best, even when you were doing well, it doesn't sound like it was wiping it out. It just sounded like that combination was keeping it under control. All right.
Yeah.
So, all right. So one thing I've had success when people got blocked in their treatment on fluconazole, switching over to itraconazole. So it's in the same family, and that family, based on research at Johns Hopkins University over 3 years ago now, we know that one of the family members called clotrimazole, which they used in their studies, they didn't use fluconazole or itraconazole, but they used clotrimazole. And they were able to show that in the lab, great killing of growing and persister Bartonella. Now, I've never used clotrimazole because it's just not supposed to be that well absorbed. Okay, so I don't use that. But I have had good luck switching when I start getting resistance on fluconazole over to itraconazole. It's a 100 milligram pill, and I have people take 2 pills 1 time a day. Okay, and I think that would couple well with your crypto as well as I think you said Japanese knotweed in there too.
Yeah, exactly. Yeah.
Yeah, I think that would couple well. Okay, so so fluconazole or itraconazole azoles are supposed to be good against growing and persisters. Okay, Bartonella, and then the crypto does growing and persister. It's good against, as well as the Japanese knotweed is too. And again, cinnamon clove oregano or not right now.
Yes, I'm taking that twice a day.
Okay. So that's also good against growing and persisters. And the other advantage of it is it can break apart biofilm. Okay. All right. Second thing, and I think you're doing this, but I just want to be thorough. One of the things that can block treatment is Bartonella can wrap itself up in your blood clotting protein called fibrin. And we want to break that apart. Lumbar kinase does that. Okay. So stay on the lumbar kinase. In addition to these fibrin nests that you get, Bartonella can cover itself in a slime layer, which is a biofilm. Lumbar kinase and the biodisrupt you're doing can help with that. Stay on both of those. Okay. All right. I would consider adding in this seaweed extract, which is called Rhamnan sulfate. And Rhamnan sulfate is found in that product called arterisol that I was talking about. Right. And there's research showing that it can repair and support the endothelial glycocalyx. And the reason I want to do that is if you get your glycocalyx working better, it will make nitric oxide, which increases your blood flow deep, deep into the really small blood vessels. And nitric oxide is a nice anti-inflammatory as well, too. All right. And the way that I have people start, as a product that's made by Calroy Health Sciences, and it has the ingredient Rhamnan sulfate in it. Rhamnan has been shown to improve the endothelial glycocalyx. I have people start at 2 pills 1 time a day for a month, and then decrease to 1 pill twice a day after that. And if you're looking for documentation about that to share with Dr. Iller when you talk with her about this, it's in my Bartonella article. I'm just going to do a quick screen share. I'll show that to you here. Somewhere here. All right, so we look in our limology guides, look under the infection plans, and then look under my ultimate Bartonella management guide. And in here, somewhere down in here, I do talk about the Rhamnan sulfate and why it can be helpful in this kind of a situation. Okay.
One last question on the itraconazole or fluconazole. Can you be on those long term? Like, is there any heart issues that can happen if you're on them long term?
So the side effect issues that you can sometimes run into with the azoles is some people can lead to hair loss. All right, so just be aware of that. And also the azoles in some people can lead to liver inflammation. I would assume that somewhere along the time that Dr. Eller has done a periodic blood test to see how your liver is doing. And if it's looked good, then you're probably fine.
Okay, perfect.
All right.
Yeah, thank you so much. Appreciate it.
Yeah. Good luck to you.
Thanks.
All right. Does anyone have? I see Missy. I see your hand is up here. Yeah. So what's your question, Missy?
But what about beets for increasing nitric oxide?
Yeah. You know, the problem is, so beets in theory can, but when you if you take, there's some companies that sell beet supplements where they really concentrate the beets, right? And it's supposed to be a source of nitric oxide. It's short-lived. You take it right away and it's gone. Versus what I'm suggesting is a mechanism that gets the lining to work better so you're releasing nitric oxide all the time.
Thanks.
You're welcome. Does anyone else have a follow-up question there? All right, let's move on here. Hello, Eric. Let's see. Any advice for someone switching to clarithromycin 500 milligrams, cefdinir 300 milligrams, hydroxychloroquine 200 milligrams after being on tovaquone, proquinol, rifampin, and azithromycin? Was on for about 5 months. Doxy 100 milligram for the last month and fluconazole the last couple weeks every other day. Nothing seems to be moving the needle on leg and knee symptoms. Knees turn purple still and feet get cold. Think Babesia Odecoilei or Bart giving that symptom. And do you have thoughts on the nicotine patches and various spike protein treatments? Thank you so much. All right. So let's see here. So in terms of this clarithromycin, cefdinir, as well as hydroxychloroquine treatment, I think what you're saying is there's fluconazole in the mix too. Is the doxy something you're taking regular still or not, or did that stop?
Just for the last month.
So your treatment would be clarithro, doxy, cefdinir, and occasional fluconazole. Am I understanding that correctly?
Yeah, and I think hydroxychloroquine too.
Okay. So the clarithromycin and doxy both can help with Lyme, Bartonella, and Babesia. And essentially what they do is they have a similar mechanism, but they're blocking protein production of the germs, okay? But they block the protein production at two different places in what's called a ribosome. Ribosome's like a protein production factory, all right? So you can sometimes get added benefit from that. The cefdinir has got some research showing it's going to be good for the Borrelia side at treating the spirochetes that sit outside the cells and may even be helpful against persister forms of spirochetes too. But cefdinir stays outside cells, and we know that Borrelia and Bartonella are inside cells too. So they have some parts that live outside, then they have intracellulars, and so cefdinir is not going to help you with that, okay? Hydroxychloroquine is interesting in that there's a couple benefits that you get with it. One, so it used to be an old anti-malaria medicine. And when it comes to treating Babesia, it seems to be too weak. But maybe your provider put you on it for that. But I don't find it to be that useful, okay? The other thing it does is it lowers acid levels inside of your cells so that makes your cells more basic, not as acidic. so that clarithromycin and the doxycycline can work better. Okay, all right. And then finally, hydroxychloroquine, one of the biggest prescribers of hydroxychloroquine, some of the groups of doctors that prescribe it the most are rheumatologists. And that is, it has both anti-cytokine and anti-prostaglandin inflammatory properties. So prostaglandins are the inflammatory chemicals that go up when you whack your knee, for instance, or sometimes in certain inflammatory arthritises. Okay, so it may help with the pain there too. So anyhow, I mean, in terms of switching, I don't have, I think you could just jump right in and do it. My only comment here about this treatment is if your Babesia is still active, this is tailored more for Bartonella and Borrelia than I would say Babesia. I'm just not seeing much that says Babesia to me here, basically.
I brought that up with my LMD, that exact concern, and asked about adding in a little cryptolepis just to have a
Yeah,
little coverage of Babesia, and he okayed that.
yeah,
So
I think that would be reasonable. And I don't know if these days, especially when we start getting more into resistant Babesia, there's an argument to be made that a lot of that resistance Babesia may actually be Babesia Odecoilei. And Babesia Odecoilei does not tend to respond as easily to the atovaquones and some of those medicines. It's the tefenequins that it seems to respond to. Have you done a tefenequin before or a primaquine before?
no, and I have Odecoilei confirmed at T Labs
Yeah,
as of 5, 6 months ago.
yeah.
My doctor's not super comfortable. I think he's holding tefenequin in his back pocket in case we need it.
Okay. Yeah, so I would, keep talking with your doc. I mean, you can only work with where your doc's going to go to, but
Right.
I would, so there's, when we look at, especially with Oda coli, there's evidence, there's some reason to believe that using the lead agent for your Babesia as your Babesia killer would be from this family called the quinolines. And the quinolines are primaquine, or the other one is tefenequin. Okay. Tefenequin is the newest, but primaquine can work too. And so, somewhere, if you're not making progress here, I would continue to bring that back up with him again. And you could find that in my Kills Babesia article. I describe using either primaquine or tefenequin in that article as well too. Okay. All right. And then in terms of nicotine patches and spike protein treatments, I have to confess I'm not as current on that area as I should be. So I'm aware that people have been advocating nicotine patches. I'm not, and in terms of the spike protein, I haven't seen things that I've tried before, or even as of a year and a half ago when I was recommending things to people actively. I just never found anything that worked that well. So anyhow, yeah. Okay.
Thank you so much for the help.
All right, Eric. Good luck to you. Does anyone have follow-up questions on what Eric and I were just talking about? All right, let's move on here. Let's see. Hello, Jacqueline. Let's see. Good evening, Dr. Ross. IgG positive for Borrelia burgdorferi, Maritima, Myoni, IgM negative. Diagnosis November 7, 24, Vibrant Labs. Have FM functional medicine provider Dr. Sillaby in South Carolina. Is this what is meant by co-infections? Treated since December with Nutra BRL, then in February cryptolepis, and in May started Nutra BRT and methylene blue drops for suspected Bartonella. Main symptom is Lyme arthritis with inflammation and pain. Recently asked MD to start taking Japanese knotweed. What dosing should Japanese knotweed be daily? My doctor has me at 30 drops one time a day. How do I know I'm breaking up biofilms and detoxing sufficiently? I take LDN, a thyroid, and compounding T3 for Hashimoto's. Thank you. Okay, so let me just say there's a number of things to just say here. Okay, so first of all, Vibrant Labs, I think Vibrant Labs has not done an adequate job validating or proving that their testing is accurate. Okay. If you've participated in these webinars before, you'll know I've said this a number of times. When independent labs develop a testing technique that is not in a test kit that they sell to another lab. They're not required to get FDA approval. If they were selling it commercially to other labs, they would have to go through FDA approval steps where they actually have to show that their lab is effective at finding infection when it's there and not overdiagnosing it when it's not there. Those are called validation studies. And Vibrant has not done an adequate job doing that on their Babesia, Bartonella, and other tick-borne infections. They have done adequate validation studies on Borrelia burgdorferi. These other Borrelia species that you have listed here are more called tick-borne relapsing fever species, and their testing has not been adequately validated for those strains, okay? So all I can say to you is that, yes, you've got a positive Borrelia burgdorferi test. I don't know what the absence or positivity of your Vibrant labs on these other infections means because they haven't validated that their test says anything. Okay. I hope I'm being very clear about that. Okay. All right. So just keep that in mind. Yeah. All right. So if you wanted, in terms of trying to get some test validation of what's there, and I have to admit, there's no perfect test here. Okay. But who seems to be doing the better test at finding an infection if it's there is IGeneX. And their test technique, which is called an immunoblot, is a method that they use to determine if you have antibodies against 8 strains of Borrelia, if you were to do their Borrelia test, against, I think, 4 strains of tick-borne relapsing fever, if you were to do that one, against the whole family of Babesia and specifically also looking for, and we think there's 20 strains of Babesia that might do this, okay? So by testing for the whole family, they identify even the strains we don't know of, basically, all right? And then for Bartonella, they test for 4 strains and the family, and we think that there are 15 strains of Bartonella that can infect you. Now, in their validation studies of their immunoblot method, they've been able to show across the board for all of those infections a sensitivity rate, meaning the ability to find the infection if it's there, of about 94%. Okay, all right. And then a specificity, which means it's accurate when it comes back positive, and when it comes back negative, it's accurate. That is running around, I think, 98, 99%. So it's an accurate test, all right? Now, I will admit that it can be expensive to do their tests. Usually, if I'm going to use IGeneX immunoblots, I'm going to immunoblot my Borrelia. I don't think you necessarily need to here because, as I said, I think that the Vibrant is accurate there when it comes back positive, okay? And then I'm going to immunoblot my Babesia, and I'm going to immunoblot Bartonella, and I'm going to look for both IgM and IgG antibodies, okay? In a minute here, I will show you an article where I wrote why I think the immunoblot's the best test, and it has the test codes, the numbers that I would have you check off and show your provider and say, I want to be tested for these. Okay, I'll show that article to you here in a minute, okay? All right, that's what I would consider doing. All right, now I will tell you with all of these infections, you're looking for clues, okay? A positive test is a clue. It doesn't conclude it, but if a positive test is there, it says, look, think about that. And then you have to look to the symptoms support possibly having it too. You got to compare both of those together, all right? All right. Then in terms of your treatment here, so again, I'm not clear what we're treating just because the testing, I don't know what it means. And I don't have time to go through all the symptoms you're having to do a clinical diagnosis. Okay. All right. What I will say to specifically, if you think that you have Bartonella, and then yes, I think there are some herbal options you can use. Methylene blue can be helpful. Cryptolepis can be helpful. Japanese knotweed can be helpful, and liposomal cinnamon clove oregano can be helpful. In terms of the dosing I would use on those for Bartonella, the crypto dosing I like to use is a half teaspoon 3 times a day. You may have heard me earlier talking about Babesia doing a teaspoonful 3 times a day, but when you're doing Bartonella, you can get by with half a teaspoonful 3 times a day, okay? Japanese knotweed, I like to work up to 30 drops twice a day, not once a day. And the cinnamon, clove, oregano, it's a capsule. I like people taking one pill twice a day on that. Okay. All right. So those are some things for it. I think, did that answer your questions for you?
Yeah, it did answer the questions. I just, I think I had asked about detoxing, how do I know I'm detoxing and sufficiently and breaking up these biofilms?
Yeah. So in terms of biofilms, if you are, as part of your treatment, if you are, or management, if you're using the cinnamon, clove, oregano, as I said, that has evidence that it will break up biofilm. If you are not using that, then you may want to consider adding in either lumber kinase as a 20 milligram pill once or twice a day. Keep in mind that is a group of enzymes that come from earthworms, and you want to have it on an empty stomach, which means nothing in your stomach beginning an hour before you take it through an hour after you take it. You can drink water though. The reason you don't have anything in your stomach, it's an enzyme. It will try to digest what's in your stomach and not get absorbed to deal with your biofilm. Okay. The other thing that's nice about lumber kinase, as I mentioned earlier tonight, is we think it can help break up the fibrin in these fibrin nest. And so that might be something for you to think about too. Okay. So if you were, that's where I would start. If you really, and people that aren't getting anywhere with Bartonella, sometimes I'll add in another anti-biofilm agent that has a number of enzymes and antimicrobial herbs in it, and like a product called BioDisrupt by Research Nutritionals, and has a lot of different things in it. Sometimes I'll add that in too, but usually I'm going to just start with the lumber kinase. And then in terms of detoxing, the one thing I would point out is I think there's a misunderstanding sometimes. When people feel badly, they think it's because I'm toxic. And actually, the majority of reason that people feel badly in tick-borne infections is because they're making too many cytokines. And so rather than focus on detox, what I try to have people focus on is being on curcumin, 500 milligrams 3 times a day is a baseline thing. And then you can, if that's not enough, then you can add in glutathione, as I mentioned earlier tonight, a teaspoonful once a day. The thing that's nice about glutathione, if you add that in, it supports liver detox, and it is useful at lowering cytokines as well too. Okay.
Okay, so I just started the liposomal curcumin,
Yeah.
500 3 times a day. How long should I wait before I start taking glutathione? And
You could add the glutathione now if you wanted to, but if you're trying to, save your money and kind of just logically see what works, right? I would give it about a month. If you're not seeing much change in a month, then I would consider adding in the glutathione.
okay, thank you, Dr. Ross.
Yeah. Good luck to you. Thanks for your question tonight. All right, let's see. I see a number of hands up here. Eric.
Hey, how's it going?
I'm doing well. How are you?
Doing okay. I just have a couple of quick questions for you. So I started taking the cryptolepis, the 5 ml twice a day. I'm also taking the cinnamon, clove, oregano now twice a day, and the Japanese knotweed tincture I ordered from your site, as well as the curcumin phytosome. So my question is, am I able to take all those products together at the same time? Should I be spacing them out? Okay. And then how long should I be taking it, and when should I start seeing any kind of evidence?
So the timeline of improvement depends on the germs that are there. Okay. So in general, if you are on a Babesia or Bartonella treatment management that's working, you would start to see some improvements by about 2 to 3 months. Okay, in general, on average. Okay, and Bartonella, for 85% of people, when you're on something that's working, 85% of the time, you can wipe it out. All right, now that may seem weird that I'm saying it here to this group, but remember, this group, you're probably part of the 15% that the 85% treatment didn't work. Okay, but for 85% of people with Bartonella, usually it's about a 6-month management. Okay, all right. Babesia usually is about a 5-month management. All right. Now, when we look at Borrelia, there's been one study that was done, and it corresponds with my experience as well too. There was a physician in San Francisco that presented this study years ago at one of the ILAS meetings, and where he took people that had Borrelia diagnosis and he put them on clarithromycin and flagyl. And that used to be kind of a standard treatment back then. And he watched to see how quickly they would start getting better. And what he found, and this is for Borrelia, okay, what he found is that by 3 months, 30% had started to improve. By 6 months, 60% had started to improve. And by 9 months, 90% had started to improve. So Borrelia takes longer when you're on an effective agent. And the reason is it grows very slowly. So Bartonella and Babesia replicate about every 24 hours. So it's easy for an antibiotic to get in. Things that grow more quickly die more easily on your antimicrobials, okay? Things that replicate slowly, like Borrelia, just take a heck of a lot longer, all right? So when you're trying to see if something is working, you've got to have a sense of what would we call more Babesia symptoms, what would we call more Bartonella symptoms. So things that you look at to see, is the Babesia part of my treatment working? You would look at air hunger, you would look at night sweats, you might look at frontal headaches, you might look at racing and skipping of your heart, and you might look at severe fatigue, okay? All right. For Bartonella, you want to look at pain on the soles of the feet, ongoing anxiety or depression, neurologic symptoms like tremors, shakes, numbness, burning kind of pains. You want to, and even air hunger can fit, and Bartonella too. So air hunger is Bartonella as well as Babesia. Okay. And you want to see, am I getting some lifting of those symptoms that are more Babesia or more Bartonella to see if your herbal antibiotics or prescription antibiotics are working. Okay.
Okay. Just one more quick question. With all those products taken, and I can take them up to 4 or 5 months altogether, no problems for that length of time.
Oh yeah.
Okay.
Again, those herbs, I've had people on for a year or more before. I haven't had any trouble with that.
Okay. And then I'm having these build up of like I mentioned before to you, I had went to an endocrinologist because I thought they were adrenals, but I was having this build up of this adrenaline, I get the frontal headache pressure, and it just dumps all at once, and then I have massive high heart rate. And a lot of times I'm not even panicking; it's just heart rate coming out from all this. It feels like adrenaline. Is that common for Bartonella or for Lyme's?
Be more Babesia. So Babesia can give you a lot of instability in what's known as the sympathetic parasympathetic nervous system, or we could call that the adrenaline anti-adrenaline nervous system. And the nerve that's supposed to keep balance between getting a lot of adrenaline surges or anti-adrenaline surges is your vagus nerve, which is a nerve that comes out at the base of the neck. But anyhow, there's an instability in that we attribute more to Babesia. And that instability can give you racing and skipping of the heart. Adrenaline surges can give you headaches. Adrenaline surges can give you sweats. Adrenaline surges can make you feel like you can't get enough air. So I tend to think of those more as Babesia symptoms.
Okay. Good. And is there any antibiotic that I could add to this? And should I add an antibiotic to what I'm doing already?
I mean, you should be talking, if you're going to do an antibiotic, go talk to your physician about that. But yeah, there are antibiotic regimens that you could use for both Babesia, Bartonella, and Borrelia. And without being able to figure out what's most predominant here with you, it'd be hard for me to say. But yeah, you could take a look at I showed you earlier tonight in that infection treatment plan section on the Lymology guides. There's a guide I wrote about antibiotics for Borrelia. There's a guide in there that I wrote about antibiotics for Bartonella called the Ultimate Bartonella Management Guide. And there's one about herbal or prescription antimicrobials for Babesia. You could look at those and then possibly talk with your doc about those.
Okay. All right. Well, thank you. I appreciate your time.
Good luck, Eric. Let's see here. Eileen, I see your hand up there. Eileen, are you still there?
Sorry, I forgot to unmute. I'm sorry.
That's no problem.
I've watched your webinars for several years now, and I appreciate all the help you give everybody.
Thank
It
you.
makes a difference.
Thank you.
I've been trying to place an order on your website.
Yeah.
Is that just me? Is that my computer, or is the website down having some issues?
Yeah, we're having big issues. My unexpectedly on Friday, my credit card processor terminated my account. And I think it's unjust and not accurate. And I've had to hire a lawyer actually to deal with it. But the difficulty I'm having now that I've been terminated by a credit card processor is getting another one to work with me. And there's a possibility one may still come through, but I'm not clear yet. And I would say probably by Monday or two, what I'm going to be looking at is if I cannot get a credit card processor so I can start doing that, I'll be trying to work out arrangements where I can send you to other places to buy the various products. I apologize. This has just been horrendous from my standpoint, but I don't have the ability because it was taken away from me basically. And I'm going to be meeting with a company tomorrow that might be able to take over doing some of the fulfillment of my products. So I'm not the one running a credit card. I would just be steering you that direction. But it may take about a week or two before I have a good solution here, unfortunately.
Well, I'm sorry you're having those issues, but thank you, because
You're
I
welcome.
bought so many things from you for so long, and I thought, did I mess up
Yeah.
something? Or
No, you did. And what my plan is in the next day or two, if I'm trying to work on a longer term solution, I may start putting links up on the site that say for these products go here, like to the vendor site, right? And for research nutritionals, products go here. And so anyway, you may be starting to see a solution like that showing up in the next day or two, but I still have one possibility hanging out there for a processor. So we'll see what happens with that.
Okay. Well, best of luck. I hope it all goes well.
Yeah,
And
I
thank
appreciate
you
it.
so much.
Thank you. Thank you. All right. Goda, I see your hand up there.
You could use PayPal.
No, they when one credit card processor terminates you, then they all do, including PayPal, unfortunately. Yeah.
Well, but you should be able to do some way through PayPal.
Missy, they terminated my account. PayPal did too. So
Wow.
I'm up shit creek right now, basically. So, but yeah, I appreciate it. But yeah, PayPal.
Okay.
Yeah. All right. Thank you.
All right.
Yeah, Goda.
Hi there. Just a very quick question. I'm new here, and I don't know where is the right place to ask the question. Sorry if this has been mentioned in your seminars before, but this is new to me, and yeah.
So down at the if you're I'll do a screen. Well, I can't do a screen share. So if on Zoom, when you're on Zoom, down at the bottom, there's a bottom menu, and you can click on something on the bottom menu that says chat.
Okay. So
Okay.
it's right there. Okay.
That's where you write your questions. Okay.
Okay. All right. Thank you.
All right. You're welcome. Jason.
Yeah, thank you very much.
You're welcome.
My question, the last gentleman asked about adding an antibiotic. And I mean, at this point, I am trying to treat it just exclusively with herbs because in earlier years, I've run into some problems with my health around antibiotics.
Yeah.
And I guess I mean, the question that sprung to my mind that I wanted to ask is in what situation would you personally suggest that somebody starts to do something like add an antibiotic to an herbal regimen?
Yeah. So again, so first of all, I've gone through different phases and the last my first Lyme patient was in 2004. Okay, so I've gone through different phases over time. Okay, and it used to be I pretty much worked only with prescription antibiotics, and as a lot of the data that has come out in the last few years on both GI health and also effectiveness of herbal antibiotics has come out, probably within the last 6 or 7 years, I pretty much moved exclusively to starting with herbal antibiotics. And the reason is generally they can be pretty good, actually. But also it protects the gut. And the gut is everything. I mean, we're now referring to it as the other brain. It's the brain of your brain. It's the brain of your heart. It's the brain of your immune system. The two-way talk that goes on between the gut and all your body systems is just incredible. So, and now having said that, there are times that, you do all you can using herbal antibiotics so that you protect the gut, and they just may not be enough to get at your tick-borne infection. So sometimes you've got to go in that direction. Okay. So I just want to frame that for you too, right? But often what I'll do is I'll try to stay within the herbal realm for about 6 months and herbal antibiotics. And that may mean start something for a couple months. If we're getting nowhere, then I might shift it up to another set of herbs or add another herb in or whatever. But generally by 6 months, if I'm not making headway, then I'm going to want to sit and talk to my patient and say, hey, maybe we ought to start thinking about either going more exclusively prescription antibiotics or adding in some prescription antibiotic while we use an herbal antibiotic regimen as well too.
Oh, great. Just one more follow-up question, which is the one that's also in the chat already, so you can disregard it, but it's relevant to the gut health.
Yeah.
When I was bit a few months ago, immediately, because I've dealt with candida, but it's been years, but immediately with my symptoms was like a leaky gut kind of candida symptom as well. It hit right away.
Yeah.
And I'm in a very, I'm finding the foods that I can eat without, completely crashing. But the question I had is in regards to some of your literature on it, and, the order of events. When I'm taking these herbal antibiotics that I'm taking now, like Japanese knotweed, cryptolepis in particular, my symptoms are breath starvation, joint pain and some burning, and some neurological, like headaches and things. They're manageable, but if I stop taking those, I'm afraid of what they'll feel like.
Right.
And my question is the ability, or how I would go about. I haven't really started with the gut health yet, but I'm I ordered some, and I'm in the process of it, and I'm wondering what you suggest in terms of taking the gut health material simultaneously with the antibiotics, as opposed to before, which I know is ideal, maybe to treat before you take them. Yeah.
So if you've seen the Ross Lyme support protocol that I have on my site, one of the things I identify is managing yeast up front. Okay. But I will also let you know that, during treatment management, it's not uncommon especially when you're on your prescription antibiotics, that you will have intestinal yeast overgrowth occur from time to time. And generally, I'm able to get people on either on probiotics, on prebiotics and polyphenols, which those both support your good bacteria in your intestines, and on either herbal or prescription anti-yeast medications, and still leave them on their antibiotics or herbal antibiotics to treat the tick-borne infection. You can do it. And actually, I do that all the time. Did that all the time in practice. So yeah.
Okay, so just refer to your literature on leaky gut and pick the products.
Yep. So again, that article that I have, there's an article I have. Let me show it to you here real quick. So I'm gonna make sure we're both saying the same thing here.
Okay.
All right. So here. Okay. So this article called "Your Guide to a Healthy Gut, Even on Antibiotics." Okay. And I will admit, it's a little long, but it gives you all the information you need. Okay. And generally, what I'm going to describe in here is you need to be on a probiotic, and there's a couple choices, and I tell you how to figure out which one you might want to be on. If your diet is not rich in starches, which we call prebiotics, and not rich on colorful fruits and vegetables, which we call polyphenols, then you need to supplement those. But if you have a diet that's rich in beans, legumes, fruits, and you get a bunch of colors, you probably don't need to supplement polyphenols and prebiotics, okay? And then in here, I do talk about herbal antifungals you can use if you need to strike balance then too. Okay.
Thank you so much. I really appreciate it.
All right. Good luck to you.
All right. Thank you.
All right. Let's move on here. Let's see. Teresa says, "Hi, Dr. Ross. What's the best way to treat the Lyme in central nervous system?" So, Teresa, what do you mean by that?
Hi, Dr. Ross. I accidentally hit enter or return and I was typing. I had a whole long story and it didn't kind of come through. So basically I have been experiencing.
They don't give you that much in those bags anymore.
Well, we got.
Go ahead. I'm sorry. Oops. Wait, oh, Teresa, hold on. I'm sorry. I muted you. I was hearing somebody. I misunderstood.
Frank isn't muted.
That's who it is.
Yeah.
All right. I just muted.
That's okay. We needed this laugh for sure.
I'm sorry. I didn't mean to cut you off. I cut off the wrong person.
It's all good. It's all good. So the last time, it's been a while since I've been on your webinars here. I was doing really well. And then all of a sudden, I think I had shared with you that I had had an ablation for PVCs. Mm-hmm. And I did really well with that. It's been like 7-8 months. And all of a sudden, these PVC started coming back, and it's like, okay, there's more to this than just PVCs. I said, so I would start protocol again and hit my antibiotics. As soon as I hit antibiotics, within a day to 2 days, gone. So I've been on it for roughly alternating cefdinir and clarithromycin with methylene blue, alternating those 2 antibiotics. And I've been good for a month, and I just actually saw the cardiologist yesterday and the electrophysiologist today, and I have no PVCs.
Oh, good.
Which is great.
Yep.
The other thing that's actually happening is I'm getting a little oscillopsia. I haven't been totally diagnosed. September, I go to a ophthalmologist, but I'm getting little vibrations.
Okay.
So I happen to chat with my retired friend that's in the medical field and said, it sounds like maybe the Lyme hit maybe the central nervous system. So I said, geez, maybe I better ask you what you think might be best to.
I see what you're saying. Okay.
Yeah, that's where I'm going with that.
Yeah. So just so you know, so I think the antibiotics you've just mentioned, you said clarithromycin, cefdinir, and then methylene blue. Is that correct? Okay.
Right.
So all of those antibiotics have pretty good penetration into the brain. All right. Especially the methylene blue. Methylene blue. So our brain has this thing we call the blood-brain barrier. It's a way of keeping things that are in the blood from getting into the brain that are toxic. All right. And effectively what it is, it's a fat layer. It's a fat membrane that keeps things from getting through. But most antibiotics to some degree are fat soluble. Not all of them, but most are to some degree, especially methylene blue. It just gets in there basically. And your clarithromycin and cefdinir should be able to get in there too. So you've got it covered right now with what you're taking.
The funny thing is, though, is once I stop and I feel like I've done well, I mean, this protocol's been quite lengthy on that and changing it up since 2020.
Yeah.
And that's like, I know you don't remember because you see so many people, but at one point I said, I think I'm in remission. And it was really good, and treating with the herbs, just a little bit of treatment.
Yeah.
And all of a sudden, bam, as usual, what happens with everybody. Yeah. So, yeah, I mean, so just basically stick with that. I mean, I want to eventually get out of there and go to herbs or.
So are you working with a Lyme literate physician at all or not?
Well, I not at this moment. I have protocol written out from our from portal.
Okay. So the it gets complicated to figure out why it is you can't get off, right? One of the things to keep in mind is that sometimes it's from being on the prescription antibiotics, you develop too many yeast in the intestines, and they trigger all these excess cytokines that make it look like your tick-borne infections aren't getting better, but really it's too many yeast in the intestines, right? So one thing to consider is look at to help figure out if you have too many yeast is, are you having increased sugar cravings? Do you have increased intestinal gasiness and bloating? Do you have any skin changes that sometimes happens with too many yeast? In females, any vaginal itching or vaginal discharge. Did any
No,
of that describe you at all or not?
not really. I'm on nystatin. I've been on nystatin for a long time,
Yeah.
and I have done other things. I have at times I've had sugar attacks, but it's
Yeah.
kind of like been like that my whole life, on and off. But
Okay.
I don't
And then,
have that.
and then have you had testing that indicates which infections you have at all or not?
Yeah, IGeneX has been done a couple of times, and it's just showing up as Borrelia.
Have they done Bartonella or Babesia on you too at all or not?
I believe that was included in on that, yes, and nothing showing.
Okay. So this is something for you to discuss with your provider, but usually when you got a treatment that's not fully getting it wiped out, you have to go back and look at a few things. First of all, decide if there's yeast there or not. I don't think there are. That's what I wanted to do. That's where I always start though, okay?
Sure.
If things stop going well, look for yeast. That's step one, okay? All right. But then if it's not yeast, then you've got to start thinking, is my regimen effectively doing a few things? And here it is. Okay, so you have to keep in mind that Lyme exists in three different forms. It has three different looks. It's got spirochete, that little corkscrew looking thing. It's got Lyme that can live inside of cells where it loses its covering. We call that the L form. It's got a microscopic cyst form. Okay. All right. And in addition, those forms can have two different growth states. They can either be growing or they can be hibernating and called persisters. All right. The best treatment is a treatment or management if you're doing herbs. Can't say herbs treat anything, by the way. The FDA says that's wrong. But anyhow, you get my point. All right.
Yeah.
All right. So the best one is a regimen that is managing and hitting spirochete, intracellular, and cyst all at the same time in both the growth state and in the persister state. That usually is going to requiring taking about three things. And I don't hear that you've been doing three things simultaneously here.
Okay.
All right. So I would wonder, and again, we don't have time to tear it apart here, but
Right.
I just, what you're describing to me says you probably are not being adequately treated to hit everything at the same time.
So if you say three things, what is the three? What are the actual three? That
So
you're
if you were to go herbally, well, all right. So your regimen right now, if you were to use methylene blue at the same time that you use clarithromycin, what was the third one you mentioned?
cefdinir,
Okay. So cefdinir is good at the spirochete.
right? And that's alternating every other day. In other
I
words,
know, but do you hear what I'm saying? You're alternating, so that's not good. Okay. So,
Okay.
all right. So methylene blue is going to be good at getting it growing and persister Borrelia. All right.
Gotcha.
At a minimum, I would do that daily, not flipping around. Okay. You would
And
want,
that I take daily. Methylene
okay.
blue I take daily. Mhm.
Okay. Then I might consider combining that with a daily cefdinir as well as clarithromycin daily. In other words, I would be running these three all at the same time.
Okay.
Yeah.
Okay.
Right. Yeah.
Now, clarithromycin is written as twice a day,
Mhm.
and cefdinir is the 300 twice a day. Are you
Right.
saying I would take twice a day and twice a day on both and the methylene blue? So, okay.
That's if I were working with you, that's what I would wind up doing with you. Yeah. That's where I would start. Yeah.
Okay. Okay.
Okay.
Hopefully this works.
Good luck to you.
Thanks so much for everything that you do. Appreciate it.
You're welcome. Thank you.
Thank you. Bye-bye.
Hannah, I see your hand up there.
Hi. I actually just found you not too long ago, and I have kind of a unique case. Try to be as brief as possible. I actually had a PICC line pulled today, so it's been kind of
So
a
Hannah, just a quick question. Is this a follow-on to what we've already been discussing, or is this a brand new topic altogether?
Oh, I don't know. I guess I kind of hopped on just briefly because we missed the time to start, so maybe it's similar to what I was kind of picking up what we were talking about.
Okay.
I just have like really high sensitivity. I just had one question because we were looking through some of the articles that you're going through. I can't take like any antibiotics anymore. I can't like the most I can do is maybe like a drop of cryptolepis every like 1 to 4, or well actually more like every like 4 to 5 days.
Yeah.
I was reading on your articles. Can you still get better doing like the most minimal, like even like 1/4 drop of like even just cryptolepis, and like I do like pectazole and stuff. Is it possible to still get better? I am getting results, but it's just hard to see that in the thick of everything. Is
Right.
it still possible if I'm this sensitive and this reactive to still get
Yes.
better?
Yes.
It is.
And yes, and then let me round that out a little bit. Okay. So first of all, if you have gotten really sensitive, make sure that you don't have too many intestinal yeast going on. If you've got too many intestinal yeast, they're triggering all those cytokines that make it look like when you take that would make so and if you've got extra yeast, then you're taking an herbal antibiotic or prescription antibiotic, you're killing even more of the good bacteria in your intestines, and so you're going to just the yeast is what's keeping you sick. Okay, so I mentioned earlier.
I heard that before about the yeast. Yeah.
Right. Okay. All right. So you want to start looking at that first. Okay. But if you don't have too many yeast, there are some people that as we treat, the as we treat, basically, they just become sensitive to medications. And I think it's an issue of detoxification. All right. So your detox system is how you clean drugs or herbs out. All right. And if you have impaired detox, that means that smaller amounts of those drugs or herbs are going to get a high blood level. All right. And when it comes to killing germs, what matters most is what is the level of the herbal or prescription antibiotic in the blood? That's what matters most. Okay. So what that's determined by is how much do you take and how does it get cleaned out? If you have poor clean out, you don't need to take as much to get a good blood level. All right. So
Oh,
yes,
because like
so
more is like built up in the blood, basically.
it just stays there because it can't get cleaned out as well. Okay. So there are people that I have managed by using only 1 or 2 drops twice a day of maybe 3 or 4 herbal antibiotics at the same time, and they got well. It is possible to do that.
Okay, I haven't been able to reach even like more than just like the 1 drop of cryptolepis. I have the biggest symptom that has been really, really hard for me is tachycardia.
Yeah.
I've ended up in the ER more times than I can count, and anytime I either detox or do treatment, it
Right.
sets my ticker off to like 180 beats a minute, and that's what's really scary. So I can't really find like a good balance of like
Right.
when to take something and when not to. Yeah.
So unfortunately, I'm not going to be able to solve that for you here in this forum. Are you working with a Lyme literate person at all or not?
I am. She is willing to work with like herbals and botanicals and things like that, but she's more of like an antibiotic person, and I just can't take any more antibiotics.
Okay.
I've tried everything. I've done Dapson. I've done like monocycline, clarithromycin, Flagyl. I've done just like IV doxy, IV
Yeah.
ceftraxin, and some other stuff. I mean, I'm just like my body just can't take it, and I also lost so much weight where it was getting really dangerous. And 5'7",
Okay.
I got to like 113,
Yeah.
100.
So I'm sorry, I'm just not going to be able to help you in this format. Basically, I can help, I can answer simple questions, but when it gets complex, you need somebody to really kind of go through everything with you, and it would take me about an hour, hour and a half to be able to do that.
I
with
figured
you.
I have a pretty complicated case, but I appreciate it. But you can, to answer the question, you can get better on even just a small amount. Okay, thank you so much.
All right, good luck. All right, Seraphima, I see your hand up. I will as much as I can, but I'm not, I just so you know, there's no way I get through every question here. So it's just, this is intended to be more of a general learning format for everyone, but, and hopefully you get some help from some of the questions I am able to get through, but I'm still going to keep working through the follow-up questions and then I'll get back into the feed here. Okay. Joan, do you have a question there?
Hi, Dr. Ross.
Yeah.
I actually posted a question on the chat, so then I put the hand up.
Oh, so we haven't gotten to your question yet then.
Yeah, sorry.
All right.
This is my first time actually on the forum, so I was
I know it's kind of hard to figure out. So anyhow, I'll come back. Hopefully, we'll see if I can get to your question. I'm not sure if I will. Okay.
Okay. All right. Thank you.
All right. Jacqueline, you had a follow-up question there?
Yeah, about the last question, or the last person who was talking about the methylene blue. So I want to do the compounding instead of the drops because my doctor has me on the drops. Well, he says I should just do 2 milligrams and no more. But you're recommending, and I'm not taking it every day. I want to take it every day. I think it's helping. So you're saying you should take it every day, but you're saying 50 milligrams. He says only 2 milligrams. Why would he say just 2?
I don't know. So I find most of us that are working with methylene blue are starting somewhere around 25 milligrams twice a day and may work up to 50 milligrams twice a day. So I don't know what your physician's rationale would be for that.
All right. Thank you.
All right. Good luck. And then Goda.
Hi. I just wanted to ask about the Teresa's question was the one that you just answered about those 3 elements in terms of counteracting Borrelia. My question would be, would it apply also to tick-borne relapsing fever if I only tested positive for that?
Yeah. So tick-borne relapsing fever, we don't think has spirochetes, intracellular, and cyst forms, nor do we think it has persister, these hibernating and growing states. Generally, tick-borne relapsing fever is something that will respond to being on a tetracycline. I have not found as useful of an herbal option as just using doxycycline by itself.
Okay, got it. All right, thank you so much. Appreciate it.
Good luck. Good luck. All right, everyone. I'm going to move on here. Let's see. Janice, we did. Janice says, hi, Dr. Russ. Hello. Joe, let's see. Is it possible to take doxycycline and cryptolepis at the same time? I recently just had a huge outbreak of symptoms. Yes, it is possible to take them at the same time. If you're, so to answer your question, is there anything follow-up you wanted on that? All right. All right, and then let's see here. Lynn says, I tested positive for Borrelia burgdorferi, Borrelia, and Bartonella. I also have tested positive for mycotoxins. I'm taking charcoal 1 cap a day for the mycotoxins and 1/16 of a drop of Hutania. I can't tolerate more per day. Also have mast cell activation syndrome, histamine intolerance, which is relatively controlled via a low histamine diet, DAO before each meal, quercetin twice a day. I am the super sensitive type and can't tolerate most things. Is what I'm taking enough to treat the infections and the mycotoxins, or is there something else I could try? All right. So again, as I said earlier, when you got a lot of toxicity, if you happen to have a person that are also a person that has a hard time detoxing, you will not need to take as many amount of herbal or prescription antibiotics. All right. I will tell you though, when you get into having mast cell activation, though, is one of the underlying problems. It's going to be hard, and that's the main thing you need to really jump on and manage. And you're doing a good job with it. I mean, a low histamine diet. DAO, everyone, is an enzyme that breaks down histamine. So you can lower histamines made in the gut. And so it's useful for that. So you're on that. Quercetin is stabilizing your mast cells, and that's good. You might also, because again, when I see a situation like this, I want to jump on everything I can do for mast cell activation. And what I usually will like to do in this kind of a situation is to also look at adding in an antihistamine, a histamine blocker like Zyrtec orally, or you can get a compounded antihistamine, which is called ketotifen. And ketotifen is both a stabilizer of mast cells so they don't release histamines as easily, and it's also an antihistamine, so it will block histamines after they get released by that. So that might be something to consider adding. And then finally, what's really good to get inflammation under control and also help stabilize mast cell activation is to be on low-dose naltrexone. Naltrexone is a narcotic blocker, and it also interferes with what are known as endorphin and endorphin receptors in our body. And if you temporarily block endorphin receptors, that can help reset an overactive immune system, including your mast cells. All right. And usually you'll start at, for somebody that's sensitive, I might start at 0.5 milligrams once a day for 2 weeks, and then try to see if I can get up to 1 milligram a day. But you might consider working with your provider to add in low dose naltrexone and possibly looking at either Zyrtec or ketotifen as in part of your mast cell management.
So just to add on to that, thank you very much. So what it's helpful to know that a small dose can help, and it's crazy that it's only a 1/16 of a drop, but it is helping to improve my symptoms in general. It's just that after some period of time, the symptoms get worse. So then I stop taking it for 2 or 3 days, and then I start again.
Yeah.
And can I get better this way?
Yeah, you can. Again, one of the most ill patients I've ever managed was a Canadian woman that was seeing me when I was up in Seattle. And she had been put on antibiotics by a provider up there, and they were just way too aggressive. It just triggered severe herx, and they kept dumping more and more into her. So it just destabilized her whole system. And by the time we got to me, we could only do 1 herbal antibiotic at a time. We slowly worked up to 4. But over the course of about 1.5 or 2 years doing, at that time, the way I approached Borrelia was to do cat's claw and Otoba. And for Bartonella, I was doing Sida acuta and Hutania. And I think we worked her at most up to 2 drops twice a day on that. And all 4 together. And over about 2 years, she got nearly 100% well. So yes, it is very possible.
And the Zyrtec, what did you say the dose on that should be? I tried low dose naltrexone years ago, and I didn't tolerate it, and I was afraid to try the ketotifen. So, but I'm okay with Zyrtec.
So Zyrtec is going to be a 5 to 10 milligram pill.
Once a day?
Yeah.
Okay. Thank you.
All right. Good luck to you.
Thank you.
All right. Does anyone have a follow-up question to what Lynn and I were just talking about there? Okay. Let's see. John. Hey, Dr. Ross, do you put any stock into things like muscle testing, diatomaceous earth, or other binders? All right. So in terms of muscle testing or energetic testing to see if something you're going to take is going to work for you, I think in some people may be relevant, but not in everyone. And if you're relying on a healthcare provider to do that testing, if you will, it's only as good as the health provider skills. So I have seen good results up in Seattle. There's a physician up there named Dietrich Klinghardt that does a type of kinesiology testing called ART testing, and he has wonderful results. But I've also seen a lot of the healthcare providers that he's trained in his technique, and I think the majority of them just don't do good work with it. All right. So doing energetic testing to see if something you're going to take is going to work is only as good as the skills of the person doing the testing. All right. In terms of diatomaceous earth, it is a binder. I don't, in theory, it's a binder. I have not seen any studies that tell me which of the various mold toxins it might be good at binding. All right. So that's the only thing, the only hesitance I have about it. I just don't have a scientific basis behind what it's going to hit, basically.
Perfect.
John,
I appreciate that.
yeah. Anything else there then?
No, it's just, for me, I asked, and I've asked a couple of these questions before, but for me, and I think for a majority of people, it's really kind of clearing out the noise and sticking to what, because I am working with an LMD, but sometimes you hear all these stories about, oh, well, this helped me and this helped me, and
Oh, I know.
so I always like to ask these questions just to kind of get the noise out of the way and just stick to what I'm doing.
I mean, yes, I appreciate that. And I'll just say this, it's a hard illness, right? And again, I think for 85% of people, these illnesses are managed easily, but there's 15% that develop chronic situations, as most of you are in. And what I try to espouse here are things that I have seen work time and time again for people in complicated situations. We always will hear of a person that this worked on, that worked on. But the one thing I want to let you know, we have to keep in mind is any drug, if we look at, there's this thing called a placebo, or I call it a healing effect, okay? And if we look at any prescription medication that the FDA has approved, for instance, when you look at studies comparing whether it's the drug that does the benefit or it might be a placebo effect. And the way they do these studies is you do a study where you give people the drug and you see what happens, and you at the same time you do part of the people get a placebo and you see what happens. And while they're being studied, they don't know if they got the active drug or if they got the placebo. And the researchers, while the study data is being collected, don't know who got what either, okay? And what we learn in that is about 30 to 35% of people that get a placebo get a benefit equal to what the drug would do. All right. So when we hear these stories that, this worked for me and that worked for me, well, yeah, maybe it did. Maybe they've got a good healing effect. As to whether it is a biochemical effect, it's hard for me to say.
Gotcha. No, I definitely appreciate it.
Yeah. Yeah. All right. Thanks, John. Good luck to you.
Thank you.
All right, everyone. That's it for me here tonight. So I'm just going to make a quick announcement here at the end. So I am preparing to return to Seattle, Washington to reopen my practice, and am looking at doing so. I'll be getting up there around mid-September. The movers are coming here in about a week, actually about 2 weeks. And I need to get my house on the market here. But once that happens, I'll be up probably mid-September, and we'll be working to find space and open my clinic back up again. One of the things I'm anticipating doing as part of that, because of state licensing laws that really became enforced during the pandemic, I will be
happened.
If you want to discuss your case with me, I'll be glad to do that. It's just that I won't be able November, a full practice being open, and before then, I'll start doing online consults where I can't prescribe or diagnose, but I can still give you advice. Okay, so keep your ears open for that one, everyone. All right. All right. Good night, everyone. Take care.
You were cutting in and out at your announcement. People noted that, just so you know.
I'm sorry.
We didn't hear any of it.
Oh, can everyone hear me now?
Yes.
All right. I said I'm going to be going back into practice up in Seattle in mid-September. Well, I'm arriving mid-September, probably somewhere in October, November the clinic will be open. And as part of that, I will be having a consult arm so that people that live out of state, if they want to get an opinion from me, I'll be glad to give opinion, but it will be opinion because the only way I can prescribe or order testing is if you're a Washington resident, according to state law, okay? But if you're out of state, I'll be glad to give opinion. So like a deeper session where we work one-on-one compared to what we're doing here, okay? So there'll be more information coming about that, all right?
Hallelujah.
All right.
Will you still be
everyone.
doing these Thursday
Absolutely.
webinars?
Yep, absolutely.
Oh, yay.
All right. Take care, everyone.
Good news, Marty.
Good night.
Thank you.
Bye-bye.
Thank you.
Thank you.
Oh, shit.